Your Sunday house call, and joining us this morning is Dr. Marc Siegel, Associate Professor of Medicine at the NYU's Langone Medical Center, also author of The Inner Pulse, Unlocking the Secret Code of Sickness and Health.
And Dr. David Samadi. He is the Chair of Urology at Lenox Hill Hospital in New York and Professor of Urology at the Hofstra Northshore LIJ School of Medicine. Doctors, good morning.
Starting July 1st.
Oh, starting July 1st at Lenox Hill. First of all, happy Father's Day.
Thank
you
you
both. And
yes,
to all the men.
all of you.
Exactly. Yeah. And speaking of Father's Day, what better way to take care of all of us than to actually go to the doctor and ask questions about what we need to do as we get older in age, Dr. Siegel? Let's say you start at 20 years old. What type of test should we have when we go to the doctor?
Before you start, I want to wish him a happy birthday. Today's his birthday. It's also Father's Day, so it's a special day.
Happy birthday. So appropriate that we're mentioning ages.
And I'm not in any one of those specific categories.
Oh, I thought you were in the 20s.
So what do you do when you start at when you're 20 years old? What do you do? Let's say you're 20. What do we do?
Well, the thing you do is, Eric, if you come in with a sprained ankle, don't expect your doctor to do nothing and just treat the sprained ankle. The doctor has an idea in his or her mind what you need from a screening point of view. And I check blood pressure. I ask you if you have a history of drinking, depression, smoking. What's your family history like? I check your heart, your lungs. I check your abdomen. I check you for hernias. I do special blood counts. Now, it's a little young at 20 to be worrying about cholesterol, but I want to know what your basic cholesterol is. I want to know your liver, your kidney function. I want to know your blood counts. Make sure you're not anemic. I especially want to check a urine analysis, which a lot of doctors overlook. You need to do a broad sweep, and then I can follow that over the years. When I get to 30, I probably will add an EKG and a chest X-ray. Now, and I might do an EKG.
Right, we're showing 20 now.
Okay.
So cholesterol, you want your blood stuff, the lungs, the ears. Let's switch over to 30. After you get that.
Now, at 30, I would probably add a chest X-ray and an EKG. I might have done that EKG earlier if you're in sports, if you're a competitive athlete. I like an EKG as a baseline. You don't have to overreact to it, but you need it as a baseline. Same thing with a chest X-ray. With a smoker, I might have started that earlier. Now, when you're 40, let's switch over to 40.
Show the 40 list.
When you're 40,
yeah, we
start thinking about something that David does automatically, which is a rectal exam, a prostate exam. I want to make sure that you don't have any bleeding, that you don't have any anemia. I check your PSA.
And 50?
And 50, I add a colonoscopy, a screening colonoscopy in everyone at the age of 50. I just check testosterone in men and also vitamin B12 and vitamin D.
Wow, that's a long list. So David, you know,
yeah,
what do us guys do? Write all this stuff down and go in and see you and say, what do I do?
First of all, it's men's health, and men are very different than women. We don't go to doctors. I deal with this all the time, and if it wasn't because of the spouses and the wives who make 70% of healthcare in this country, decisions in this country, they would never come to our office. When you talk about the 20-year-old, instead of doing all panels, the key is testicular cancer among that age is very popular. So you want to do a testicular exam, you know, and that involves examining the testicles, making sure that there are no lumps or bumps. You look for hernias, something called varicoceles, which is like veins around the testicle that has potential for infertility. That's what I do when they come in. 30s are actually a good time. I leave them alone. I want them to have a good time. When they get to their 40s is when we come back in again, and that's when the PSA. Now, the PSA screening, we've talked about this. The guidelines almost changes every week, and everyone is getting a headache from this. Get a baseline PSA when you're in 40s if you have high-risk genetics, African Americans. Otherwise, after the age of 45, you can get your PSA every year. 50-year-olds is when colonoscopy kicks in, and nobody would debate about the screening benefit of colonoscopy. If you have polyps, that can convert to cancer, and that's why you want to have colonoscopy and remove them. And then finally in 60s, which, Eric, you have a lot of time to get there, that's when osteoporosis and making sure that you take your vitamins, vitamin B12, calcium, and vitamin D3 is important. So the big message for Father's Day is that screening and prevention save lives. And you have to be proactive, and you have to take care of yourself. We talked about checking your level of testosterone, etc. And of course, I think what Marc does, which is extremely significant, because there are two big tickets. Heart, which is a leading cause of death, which I know he takes care of all the cholesterol panels, and cancer, which is a common work that we do.
You know, David's making a great point, first of all, about men being deniers. Men are not coming in as much. When they come in, they want to get out. They don't want you doing this stuff, and that's bad. For heart disease, I have to focus on who's at risk. If you're a diabetic, if you're a smoker, I'm more interested in preventing that in someone that is at higher risk. So not only do we come in, like David is examining for testicular cancer, but he wants to know the family history. Same thing with prostate cancer. In terms of prostate cancer, the family history is a key.
Absolutely. So this is a very important point because you can't just screen everybody the same way. Individualizing the care, looking at the guy and find out what his risk stratification is. Is he higher risk than the next guy that comes in is very important. And the role of surgeons and medical doctors working together as a team in this particular field is extremely important. Everybody that watches the program, they need to know what their cholesterol panel is. Your good cholesterol HDL that Mark always recommends has to be at least over 50 or 60. Your LDL bad cholesterol should be less than 100. Your fasting blood sugar, which is important for diabetes, has to be less than 100. You need to know these numbers just like you know your Social Security and carry that with you. That knowledge is important.
You know what scares me as a man? That there's something that we overlook that we won't know. You talk about prostate cancer. Sean Kimmerling, he was a colleague, sportscaster in New York, 37 years old, has a foundation for testicular cancer.
There you go.
A young man whose life was cut short and you would never even know it.
Our message today is good doctors don't overlook these things. You said to us at the beginning, Eric, what do I know? What do I need to know going into the doctor? Well, you come to see doctors like David and myself. You don't need to know anything. We'll ask you the questions.
All right, so ask your doctor and make sure you get the numbers.
Be
Great
proactive.
advice. Great advice.
Get involved.
Thank you, of course. We do, though, have a quick correction that we'd like to make about a segment that we had yesterday. That's on the possible health risks of BPA in plastic containers. You've heard about that? Well, yesterday we mistakenly showed footage of people drinking bottled water from containers that are made of PET plastic, and some of the bottles that were shown and recognizable as Poland Spring water bottles. This type of soft plastic, we're told, does not contain BPA, and Fox News apologizes for that error in showing some of that footage.